My full name is Angelique Harris, and I'm in the Department of Social and Cultural Sciences there. I'm an assistant professor of sociology in that department. I primarily teach race, gender medicine, culture, health and illness, social movements, primarily courses within the department that deal in some way, shape, or form with health and health issues typically. Yeah, so the research I conducted was based on my work examining health within African American communities. More specifically, I was looking at the role that motivational interviewing plays. At least community health workers that are trained in motivational interviewing. I was looking at the role that they have within helping to promote health and healthcare and wellness overall among African American women. And again, more specifically, I was examining obesity. However, beyond just obesity, I was looking at overall health issues. Well, because there's so many different factors influencing the experiences of healthcare that women have, and that women are expected to be not just caregivers, but also nurturers, and that when you're really talking about health and wellness, you're really talking about, in essence, women quite often, that women are the ones who provide health care. Women are the ones that provide all the caretaking roles. And also importantly, women are the ones, particularly when you're looking at communities of color and whatnot, that are experiencing different access to health care. And so because of the fact that they're taking care of their families and they have so many obligations, they quite often can't focus on their own health care and their own wellness. So focusing on just the gender aspect and the various gender roles that are associated with that is very important. The work that I do is very specific for Milwaukee, so the development of the community health workers in terms of them learning motivational interviewing and then being immersed within our actual project is very important for Milwaukee in large part because they really know the experiences of the people here in Milwaukee. They're from Milwaukee, they've worked in Milwaukee, and by them I mean obviously the community health workers. So as a result, they have a really good understanding of the various challenges and experiences that women here actually have. So everything I mentioned before, like the community that I study, doesn't really have any grocery stores in that area, and the public transportation is really poor in that community where they need to transfer to get to grocery stores if they're transferring on the bus. So it makes it really difficult to be able to do all that and very time consuming. So the many challenges that are specific to Milwaukee in terms of, racial discrimination and segregation and poverty and the lack of jobs and high black male incarceration rates and all these other factors influences the experiences of black women and experiences they have in actually seeking out health care on their own and being able to focus on their own health care. So as a result, this is one of the reasons why it's so specific to Milwaukee and really a good fit for the city. Well, Marquette's is a Jesuit school, and so its mission is social justice and the promotion of social justice and knowledge, etc. And so that's one of the things that I'm really doing within my research is trying to promote an education, and at least a better understanding of how people can address the health issues that they may have. And so, for example, with the use of motivational interviewing, that's in essence using intrinsic motivation to try to encourage behavior change. But importantly, not only just using that motivation to get people to change their behavior, you're also figuring out, what really works for them, and also what would we try to increase the amount of education they have about whatever health issue that they're experiencing or these that they're focused on. And typically for a lot of the women in my intervention, although our focus is on obesity, most of their issues were, again, obviously hypertension, heart disease, things like that, diabetes, etc. And so by addressing those issues, you're also going to address obesity as well, but you're doing it in a way that actually makes sense to the population of people that I'm studying, and so it makes sense to these women. And so using that motivational interviewing approach really gives us the opportunity to focus on them understanding and them working towards their own health on their own. So I think it makes it a really good fit for Marquette.